Okay, we'll begin our physical exam by making an overall assessment on the patient's general appearance. He's a well-appearing adult male. He is in no acute distress. He appears to be mentally intact. He drove himself to the appointment today. I saw him walk in. He appears to be alert and oriented, and this leads me to believe that his mental status is intact. From here, I will inspect the patient's head, face, and neck. I don't see any skin discoloration, any areas of swelling, or any acute trauma injuries. I will then palpate the scalp, noting any areas of tenderness or any areas of indentation that could indicate trauma. Noting the hair's texture, it's soft and evenly distributed in a normal male pattern. I will then assess the patient's face. The patient's face is symmetrical, no areas of swelling here. I will have the patient follow my finger, noting any nystagmus, noting pupillary constriction as I bring the finger in. This is testing cranial nerves 3, 4, and 6. I will then test cranial nerve 5 by having the patient clench their jaw, noting that there is bilateral strength equally on both sides. I will then have the patient close his eyes, and I will test cranial nerve 5 and ask him where he feels me touching.
Right forehead. Left cheek.
Perfect. And then I will test cranial nerve 7 by having the patient smile, puff up their cheeks, and close their eyes as hard as they can. Perfect. I will do further visual assessment by having the patient cover one of their eyes, have him look at my nose, and ask him when he can see my fingers.
Yep. Yep. Yep.
And then repeat on the opposite side.
Yep. Yep. Yep.
And this is testing cranial nerve 2. I will then further examine the eyes with my ophthalmoscope. I'm going to look for the red light reflex, which should be present and is present. I'm looking at the disc margin here. It's sharp. The sclera is white and conjunctiva is pink. I'll repeat on the opposite side, and the findings are the same. From here, I will inspect the nose. The nose is symmetrical with no obvious discoloration. I'm going to palpate the sinuses, noting any areas of tenderness. While I'm palpating here, I will also palpate the lymph nodes, noting any areas of swelling or tenderness. I'm checking the axillary nodes and the supraclavicular nodes here. I will continue with my nose assessment. I'm looking in each nostril, assessing the turbinates. They are pink and moist. There's no areas of drainage. Looking on the other side. And each nostril is patent. From here, I will assess the patient's ears. I am looking for any redness, obvious discoloration, any drainage or swelling, seeing if the patient's ears are tender when I begin inspecting them. I am looking for the tympanic membrane. It's pearly gray. There's a light reflex on this side at 5 o'clock. I'll repeat on the other side, looking for any redness, tenderness, or swelling. Light reflex is present at 7 o'clock, and the tympanic membrane is pearly gray. There is some wax in the ear canal here. From here, I will assess the patient's mouth and throat, looking at his oral mucosa. It's pink and moist. Tonsils are 2+. They're present but not swollen. Uvula is midline. I'll ask the patient to say ah. The uvula lifts and I can visualize the palate. I am looking at the tongue here. It's pink, moist. I'll have the patient stick his tongue out. It's symmetrical. Move it side to side. I'm testing cranial nerve 12 here, looking for any lesions or fasciculations as well. From here, we'll further look at the neck here, just palpating for any tenderness, soreness, masses. I'll have the patient turn against my hand here, 5 out of 5 strength. I'll have him turn against the other hand, 5 out of 5 strength. I'll have him raise his shoulders. That's also equal bilaterally. And then I'll have the patient swallow. I'm palpating the thyroid gland. It's smooth and moves upward when he swallows. From here, we'll begin the respiratory exam. I'm just going to begin by inspecting the skin. It's pink, warm, dry, no obvious lesions, no areas of redness or swelling. I'm going to begin by having the patient say 99.
99. 99. 99.
And tactile fermetus is present throughout but diminishes as you move towards the bases. I am then going to percuss, noting areas of resonance, which is an expected finding over the lung tissue. And then I will auscultate breath sounds. Big breath in, big breath out. Checking sounds in all fields, noting that they are clear and equal bilaterally with no adventitious breath sounds. I will repeat on the anterior side, listening to breath sounds. Again, clear and equal bilaterally with no adventitious sounds. And then I will begin my cardiac assessment. I am inspecting for the PMI, noting any thrills or heaves. I cannot see this patient's PMI, but I should be able to palpate it over the 5th intercostal space, just medial to the midclavicular line. In this case, I can. I will then auscultate the cardiac sounds, listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are present throughout. There are no murmurs present. Patient has a regular rate and rhythm. I am then going to palpate for pulses, feeling the carotid pulse, feeling the radial pulses, feeling the post-tibs, and the dorsalis pedis pulse. I'm also going to auscultate the carotid arteries, listening for any bruits. No bruits are present, regular rate and rhythm there as well. From here, I'll take a closer look at the patient's upper extremities. So I will have him move his wrists in each direction here, flex and extend his arms, flex and extend his shoulders. I'll take a look at the patient's skin, noting skin turgor, looking for any tenting, which is not present. Looking at the patient's nails, noting that they are pink, transparent, there's no clubbing or ridging here. I'll have the patient take each finger and touch their thumb, testing fine motor, and then I'll look for pronator drift by having the patient put his arms out right with his eyes closed and see if his arms move at all, which they do not, which is an expected finding. From here, I will test the patient's reflexes. We'll begin with the brachioradialis reflex. It's 2 out of 2 and normal throughout. I'll do the biceps reflex, which is 2 out of 2, and then the triceps reflex, which is 2 out of 2 and normal. I would then repeat on the other side. From here, I'll have the patient lie supine. I'm going to do my GI exam. I'm just going to begin by inspecting the abdomen. It's a flat contour. The umbilicus is inverted and midline. From here, I will auscultate. Bowel sounds are present in all 4 quadrants. Then do palpation, noting any areas of tenderness, feeling for any masses, assessing rebound tenderness specifically. The patient does not have any rebound tenderness. No liver borders are felt and no splenic borders are felt. I will also palpate the femoral pulses. They are 2+ bilaterally. I will then have the patient sit up, and I'll continue my musculoskeletal and neuro exam on the lower extremities. I'll have the patient extend his leg, noting any tenderness or changes in range of motion, roll out each ankle, eversion, and do it on the other side. And then I will check his reflexes. So we're going to check the patellar reflex, and then the Achilles reflex, and they are 2 out of 2 and normal. I would then repeat on the other side. And then the last thing I need to assess is the patient's gait and spine. So I'll have the patient stand upright. I'll have the patient turn to his right and then to his left, lean right, lean left, rotate each way. Noting any pain or changes in range of motion. Then I'll have the patient lean forward, looking at the curvature of their spine, noting any scoliosis, and then I'll have the patient walk, just taking in his gait, normal stride, normal balance and coordination, normal arm swing. So the patient, again, is a healthy male. He's just here for a well physical exam. No differential diagnoses are needed at this time.